Hi, I'm Dr. Bill Lovett from your Wellness Center. This is the second part of a series where we're actually doing a three-part series based on testosterone, symptoms, treatments, and kind of where the end results are going to be. In the first part, if you didn't catch it, we talked about the symptoms of low testosterone. Those particularly, and I would encourage you to go back and look at that specifically, but basically decreased libido, decreased sex drive, decreased erection strength, fatigue, decreased productivity at work, those kind of things. So go back and look at part one. I covered those in pretty much detail based on something called the ADAM questionnaire, which is published out there. It's what most physicians use. In part two, I'm going to look a little bit more at treatment and why we do treatment and why we do specific treatments here based on our experience in knowing what our patients want. There are a lot of things out in the market. You see them probably on a daily basis, basically being produced by many vitamin companies or some other company. And I'll be frankly honest with you, the majority of them do not work. Most of the time, they're not a lie, but you don't find any published independent medical data that they actually work. So I just want to caution you that the only thing that really has been shown to absolutely work pretty much 98+% of the time is actually using true bioidentical natural testosterone, at least in our office. There are other types of testosterone out there too. There's some particularly gels that are out there, or creams that you can put on, and also injectable. My issue with those are they are all synthetic or they're protein derived. In other words, either they may be a sort of a testosterone molecule, but they got proteins on the side of them or something else on the side of them. In order for them to be completely active in your body, they have to go to your liver, cleave off or change something to turn it into true testosterone. I personally don't like anything going to my liver to do anything because I feel my liver is important. Yeah, it's your major detoxification organ in the first place. So it's spending all its other time detoxifying things in your body. Why should I load it with another problem? Whether you're taking Tylenol is highly metabolized by the liver, and certainly other medications over the counter are also. So when we here in our office talk about testosterone, we do not mean any of the synthetics. When we talk about testosterone, we're talking about pure testosterone. The same molecular structure that's in your body now or was in your body at one time in your life that really gave you energy, it gave your muscles, it kept you maybe lean, it helped your brain function, it helped you from decreasing from diabetes and hypertension and some of the other things that occur as we get older. If you realize it, back when you were 16 and 18 years old, you didn't have type 2 diabetes per se. You didn't have high blood pressure. You may have not been as heavy as you are today. You may not have had high cholesterol. And part of that reason is your hormones, especially testosterone, was much higher in your body during that time. So when we talk about testosterone here in our office, we're also talking about giving you something back in your body you used to have. So it's almost like a supplement, just like taking a vitamin D3 supplement because you don't have enough vitamin D3 in your body anymore. So we kind of like supplement your body with testosterone, and when we do so, we do it in pure form. So basically, when we put testosterone back in your body, it takes a little bit of time to absorb or basically whatever, but it doesn't have to metabolize. It just has to absorb and start working like your natural testosterone does. Because what we put in you is really bioidentical natural testosterone. And so then what we notice over the next several weeks is your energy starts picking up, your libido starts picking up, your brain function starts picking up. You may decrease fat mass, you may increase muscle mass over several months. And the cool piece about it is about 98% of our patients that get testosterone keep coming back. And that's just remarkable because how many physicians' offices does 98% of the patients still come back? And when you look at that year after year after year, many of our patients actually, when they don't come back, actually are going to Florida. They're moving to some other part of the country. And so therefore we have to help them hopefully find somebody that may practice in a same or similar way that we do in our office. So testosterone therapy can usually be given in two ways, at least in our office. I know there are other bioavailable ways out there, but again, I think I've explained why we don't do that. About 98% of our patients, we do what's called pellet therapy. This is where we actually put these little white teeny tiny pellets, inject them into the fat of your butt cheek, and we just let them dissolve over months. In women, they last about 4 months, so we have to put women's in about every 3 months, because as the old ones are wearing out, we want to put new ones in starting to kick in. Men, we put those in about every 4 months. And obviously in men, we use about 15 times higher doses than we do in women. So they get a lot more pellets, but the nice part about it, their pellets are also larger, so they don't have to get them as often. But that's how we do about 98% of our patients. And basically the testosterone just leaches out of these little pellets, and they dissolve over a period of months, and they're gone. And it just works out really well. It allows us to get really great levels on the individuals. It allows us to tailor your level for you, and it just works really well. A small percent of our patients have to use a cream, whether they may have an allergy to something, or there may be some other reason, or one of the other reasons are that they may be battling certain medical issues like cancer and things, and we need to be able to turn it off quickly if we have to. So those are the kinds of mechanisms we use, particularly the creams we use. We actually do rub on the genitalia because we want them to absorb very well. And again, most of the synthetics you put on your skin, on your arms, or some other part of your body. This is kind of the end of part 2 of what we're doing. Part 1, I've already talked about really kind of signs and symptoms. And again, I would refer you back to that. It's a very short little blog video, maybe about 2 minutes, 3 minutes in length. And then in part 3, we're going to talk about some of the result issues and kind of our expectations down the road, and how things look once you've kind of gotten through the hormones. One of the things you may want to do is get on our website. After looking, there's a resource button at the top. If you're interested in coming in and seeing us, just click right down below that. You'll see the initial consult form. Fill that out, hit submit, and then we usually will call you back within 24 to 48 hours and have a discussion of what the next steps are.